Today is Wellness Wednesday, and we want to take a few moments to focus on mental health during the holidays. Joining us in studio today for this sponsored segment are Memorial Healthcare social workers Stacy, Schaufele and Kathryn Gosaynie, who specialize in working with pediatric and adult patients in their practices. Good morning.
Good morning.
Good morning.
Yeah, thanks for coming in. We'll start with Kathryn. You work directly with pediatric and adolescent patients. Why do you seem to see more mental health issues during this time of year in the holidays?
I think it can be easy to feel that the holidays are a magical time for children, and unfortunately that's not always the case. Often they are experiencing stressors just like adults may during the holiday season. And that can be from a multitude of things. For example, their routines change often during the holiday season. School is on break, bedtimes and sleep schedules can look very different, and often for our students with food insecurity, they're relying on breakfast and lunch often through the schools. And so things can look very different at home, family stressors as well. So with our children and adolescents, we see that they can really have increased anxiety, depression, and overwhelm during this time of year. Also, they're affected by grief and loss often, missing loved ones during this time. So we find that with younger children, often the signs and symptoms of that can look like increased behavioral outbursts, tearfulness, emotional issues, and also with adolescents, it can look like maybe more withdrawn as well during this time of year.
Yeah, a lot of changes and a lot to consider there. Stacy, you jump in here. What are some of the ways we can better take care of our mental health just throughout the year in general?
That's a good question. One of the most important things for taking care of our mental health is to remain connected as much as possible, to remain connected to loved ones, to friendships. Social connection is one of the most important pieces for mental health. And certainly that can be hard for people who live a more isolated life. So as a therapist, we really try to encourage people to get connected within their communities, with any supportive family member or friend.
Yeah, does that go for everyone, including young people too?
Absolutely. Connections are so important this time of year, and maintaining connections within the school setting, within the community, coaches, positive friendships, mentoring, those are all such an important resource for children and adolescents this time of year.
We're humans, we're made for interaction, right? Kathryn, when should someone maybe then reach out to a mental health professional with all that said?
We find that when these symptoms are really affecting areas of their life, then it's time. So it can be, of course, normal to experience some situational, stressors in a busy season of life. But when it can be difficult to go to school or to attend family functions, to go to after-school activities, or they're finding that things like outbursts are starting to affect them, then it's time to call and get connected to a mental health professional. And we like to help them learn coping skills and tools to help make it through a tough season.
Okay, Stacy, with that said, if you know someone out there who may be having a mental health crisis or needs some extra help, what can we do to help them?
Also a very good question. We really encourage people, please don't wait until there's a crisis. To be proactive. If you're noticing the symptoms that Kathryn mentioned, to please reach out. First of all, you can always reach out to a primary care physician, and they can provide a referral to a mental health clinician. Also, Kathryn and I have found a good resource is psychologytoday.com, and you look under the therapist finder, and that offers services for a wide range of area codes.
You can get connected that way. All good information to consider, and again, consider using the National Suicide and Crisis Lifeline number as well. That's 988, easy to remember. For more information, though, you can go to memorialhealthcare.org or call that number that you see there on your screen. Thank you both so much for your insight on this very important topic.
Thank you.